Hey, awesome. Welcome back to another live lifts. We are live and direct. My name's Dr. James. Let's attack the bar. Whew. Oh. Welcome back to Live Lifts. Welcome back to my channel. Catch your breath. Welcome back to Live Lifts, ladies and gents, boys and girls, and everybody in between. Welcome to Live Lifts. Welcome to all the new subscribers. We broke 100. Steady trajectory. We broke some seasons records, some personal records this last week in our most recent streams. If you haven't caught them, do catch them. Welcome to Live Lifts, where we lift and we learn, put the science into strength, and of course, we just said joy. Keep it fit, keep it strong. It's the best remedy for everything. All of your hardships, your health is your wealth. Right, so welcome to today's stream. This is March for Men stream. This is the month of March, and it's prostate cancer awareness stream. Hence, so the reason why we're doing this is because we do believe in health and science, and we also use this stream to raise awareness of causes and promote research, because I love research. If you don't know me, I used to be a physio. I am currently a doctor, licensed in the UK, and I'm an academic doctor, so I do clinical stuff with patients, and I get the really fascinating, blessing, fortunate, amazing position of being an academic as well, meaning I'm in contact with students, medical students, people at university, do research, lab-based research as well, so I love all that. And also, you might have noticed, I love to keep fit and I love to keep strong. So, we use it to talk about strength and science, and of course, good causes with health, and so on. Some of you have reached out to me, you've requested specific topics, such as back pain, shoulder pain, so we've covered a couple of those already. Ice baths, we did a research review on that as well recently, and we will be doing more of that on the podcast. So welcome. Do subscribe and share. They're the two big ones that really help. Of course, I would like to have donations on this channel for good causes like prostate cancer and other causes that we're going to represent, but I don't have enough subscribers yet to have a donate button, so maybe you could help me with that. Should we do another set? And then we'll talk about what we're going to do today. All right. And then we'll talk about how we're feeling. Get the legs popping again. Woo! Ooh. Ooh. Wow. Ooh. Wow, that is tough. That is. Ooh, I said to you in the previous live stream, or maybe the one before that, do not underestimate the lighter days. They are still taxing. But these are tough. But nothing's more tough than a diagnosis of a cancer. So today's theme is prostate cancer awareness for the UK. So I got these t-shirts from Prostate Cancer UK. If you do not want to donate to their research, they do good work over there. I've looked at their studies and publications on their website, which we will be going through the generalization of what they do over this next month or so. So if you don't donate cash directly, buy the merch. The merch is good. It's actually really good. It's actually really cool. They've got some really good designs and logos, and it's actually really good quality. I'm wearing this t-shirt today. I got a couple of t-shirts. Got this white one, there's a black one. They're really good. They're not too heavy, so they're perfect for working out in. They'll hold a good sweat. They've got a good size to them. They're not too boxy and square. They're kind of a little bit fitted as well. Nice. So do buy some merch from Prostate Cancer, because all the proceeds go to helping research and pushing forward the progress, amazing progress that those guys have made to find a cure. So we'll be raising more awareness of that over the next month here throughout March. I do not get any promotion or sponsorship or affiliation for this. I'm just doing it because it's a good cause. So I don't want anything in return. Just buy the merch. Just buy their merch. Right, so what are we doing today? Live list today, March of Men stream. We are doing lighter day squats because we did heavy squats in the previous stream. We did 165 for twos. We did 5 sets of 2. And I didn't realize how hard that was, right? But it felt quite easy at the time. But that we did that on the Thursday, didn't we? So 2 days ago. On the Friday, wow, I slept. Man, I slept. And I slept again really well last night. So I think there was some kind of delayed stress response to that because I still feel like I was recovering from it. It is a very big demand on the central nervous system. So 48 hours later, we're doing lighter day squats. We did 165. Today we're doing 145. We did 5 sets of 2 on Thursday. Today we're doing 3 by 7 on this lighter day, which is perfect really. That's nice, and that's really nice. 3 by 7, 48 hours later is really nice. Well, not nice, a little bit hard, but it's a nicely structured to your program. So whatever your weight equivalent is, you don't have to be doing this amount of weight. If your weight equivalent of that is 30 kilos to 70 kilos or 60 kilos to 40 kilos heavy light, it's for your level of ability. I mean that with respect. It's going to be adequate to test your body, and that's what this is all about. It's about progress, because we've done nothing but continuously progress throughout the entire 6 months, and we've never been bored. We've been having fun, and it's really, really good style of training as well. So let me know how your training's going and what works for you. So what are we doing today? I should answer the question, shouldn't I? Lighter day squats. I justified why we're doing that because we did heavy squats the day before, the session before. Lighter day squats. We're then going to do front squats, so there's a lot of squats. We're going to do front squats, but that's obviously like, I'm never going to be able to do like 140 or 160 on front squat. It's going to be a lot lighter. I don't know what I could do today. I haven't done it for a long time. It's probably going to be between 80 to 100 kilos, I'm not sure. So we're going to do 3 sets of that, and that is going to lead into clean and jerk. We're going to do Olympic lifting today. Not only because it's hard, but also it's a good test of all-round functional dynamic explosive strength and power, and also it's complementary to what we've done this week. We've done a lot of deadlifting this week, we did a lot of shoulder press this week, we did a lot of squats, so let's bring that all together and do some clean and jerk. I think it's absolutely fantastic. Right, let's do the final set of this, and then we'll talk about how we're feeling after the last session. I touched on it briefly a moment ago, but I'll tell you in a mo. So yeah, reach out to Prostate Cancer UK, guys, and look, they've got some fantastic merch on their website. Get yourself some merch. All right, mate. So do buy some merch. I do see people wearing it around the UK as well, and abroad as well. The work they do is fantastic. And we'll talk more about the condition in general a bit later. Let me focus. Come on, we need 7 reps. No fail. Ooh, nice and tight. Come on. Damn. Woo. Wow. Give me a moment. Need a breather. Wow. Ooh. I think we'll start off with 70 kilo. Should be all right. I did a little warm up off screen. The wrists and the shoulders. So first set might be a bit rough, but we can only try. You've got to try the things you don't like. And one of the things you might not like is to go and get your prostate tested. Especially as a bloke, it's not nice. So there's various tests you can do. So one of the things, of course, is the rectal examination, which is a finger up the bum. It's quite an old school method. Used it more when there was not much testing available, but advances in laboratory testing have it's still a part of the workup, but it's not very sensitive or specific for the diagnosis of prostate cancer. So now we've got blood tests. So they will look for something called a prostate specific antigen, and it's released by the prostate. It can be released during a prostate cancer. It can be released during inflammation of the prostate, and it can be released during growth of the prostate as it gets abnormally large as we get older, usually in response to levels of testosterone and age. So you can go for a quick blood test, reach out to your GP or your specialist nurse. We've got fantastic nursing staff in the communities around the UK now. So if you know somebody who has been affected by prostate cancer, of course, you know, this service is available. It will affect 1 in 8 men and 12,000 people, according to the latest statistics at the time of recording this. 12,000 people a year will die. And the reason why usually is because it's very hard to detect. So it's a bit of a silent cancer. And we'll talk more about the symptoms after we've done another set. But we'll be recapping over lots of different things throughout this month to raise awareness of it anyway. But 1 in 8 is a lot, and 12,000 deaths a year is a lot as well. Let's try a set of this. Let's see how we're feeling. I need a bit of chalk. See how we do on this. Not done it for a while, but we should still have the technique from doing the clean and jerk. Just to try the chalk. This is a lot of pressure on the wrists as well. 3 sets, so we'll see, we'll build up. Yeah, technique is good, feeling good. What we will do is though, change our shoes. Get into the old appropriate foot attire. Switch these over. So, how are we feeling after the last session? Do you know what? I did an extra bit of work off screen before the warm-up, before the stream. I was usually doing the warm-up, so I did a little bit of extra work on my groin, my adductors, because I knew we were doing very heavy squats and injury prevention more than anything. So my groin was a little bit tight, not tight as in a bad way, but I could feel it had been worked, especially after doing the heavy squat. So that loosened up a bit today, which is good. It loosened up completely, in fact, today. So very pleased with that. What else did we do? Heavy squat, and we did the deadlift as well, didn't we? So in the previous stream we did a lighter day deadlift, where we did 4 sets of 7 reps on one. How much weight was on there? 140-ish, 140. Yeah, it was like 145, wasn't it? So we did a fair bit. So I could feel it in my core, in my abs. They were really like well worked. And I could feel it in my hamstrings a little bit, which is really good because it's very positive. It means that we're hitting the right areas when it comes to doing deadlift. Definitely feel it in the legs, not in the back. And then we finished off with was it a heavy or a light shoulder day? It was a lighter shoulder day, wasn't it? It was 60 kilos. So we did 60 kilos on the shoulder press, which is really developing the shoulders, because we did 80 kilos and then 60 kilos in the last couple of streams. So it's really nice to bring that together today with the clean and jerk. Nice. So the reason why we're only going to do a couple of sets on the, well, we do 3 and 4 sets after we've warmed up, on the front squat is because we've just done heavy squat. We've done heavy squat a few days ago, we've done light squat now. And there's still a lot of volume there. There's still like 6 or 7 sets that we would have done. And then we're going to go and do the clean and jerk, which is more squatting and leg work as well. So there's a lot to compound in. So you are getting a good workout. It's just spread out over several exercises, and because ultimately it's about performance. So take a little bit longer to get on than the Adidas because the laces are a bit fiddly, but we will review these in a future stream. Awesomeness. Right, let's do another warm-up set on this 70. Just stretch out the lower back a little bit as well, actually. And sat down for a little bit. Loose, foot switched on, incredibly loose, tidy. Right, let's do another set on this. Wrist flexibility needed, you'll find. I think we're ready to go up, aren't we? Yeah. A couple of tens. So there's likely so we just spoke about the testing for prostate cancer. So they used to do, as I mentioned, I'll touch on that a bit more now, got a bit of a break. They used to do finger test. They used to feel for your prostate up your bum. It's one of the glands that you can feel. It's a gland, you see, about the size of a walnut. And the GP or the hospital specialist would usually feel around, see if there's any gross lumps and bumps. Now, the issue with that is the prostate can grow over time anyway. So if you're feeling an enlarged prostate, is it down to cancer, or is that down to just growth from getting old? Now, it's not. So that's what I mean. It's not a very specific test, is it? You know. So that's why the researchers developed these blood tests. So the blood test will show usually a raised level. Now, the interpretation of those levels will be down to the specialist, and it doesn't always mean that a raised level is because you have a prostate cancer. So they would usually have to combine the finger exam with the blood test, and they would have to take information from something called a biopsy as well, usually. So a biopsy essentially is just a sampling of tissue that they take, and they can use biopsies for anything. You can have a skin biopsy, a bone biopsy, a muscle biopsy, and in this case, a prostate biopsy, which is essentially just a sample of tissue they look under a microscope. So once they've done that, The only issue with taking a biopsy, so the first test they used to do was a finger test, then they used to take biopsies and determine if a cancer was present or not. The only problem with the biopsy is you have to know the area of the tissue or the prostate that you're taking the biopsy from. You have to be able to, you need to be taking the tissue that's got problematic cells. So if you think there's a cancer there, the biopsy has to involve that part of the tissue with the cancer cells in order to detect them. Because the cancer might not be growing all over the prostate, it might be just in a specific area of the prostate. So you need to know where you're going to take the sample from. Because if you take a sample that's clear and normal, it's only because you've sampled that area of tissue that's clear and normal. I hope that makes sense. So usually, you know, if the combine this now with the research they did, there's a really nice study with an MRI scanner, and they showed that in this study essentially they showed that when they scan the prostate for specific areas of growth, they can direct the biopsy to those areas, and of course it's much more better, easy to detect if you're getting a good tissue sample in the correct area. So that led on to further studies now to help diagnostics. The issue that you have is prostate cancer is not routinely screened for in the UK, like other cancers such as bowel cancer and something with the blood vessels in the stomach, the aneurysms of the aorta. They're routinely screened in people usually over 65, or people with a pulsatile mass in the stomach. So, you know, those kind of problems and cancers, you know, bowel cancer specifically, you can take a sample of your stool, see if there's blood in it, or see if there's antigens in it. But prostate cancer is not one of those cancers that has a screening. It's not a nationwide screening at the moment. We are getting better at picking it up. Some people are detected early, but most people are detected late, unfortunately. And we'll talk more about the signs and symptoms soon, and a little bit more about the testing. So we mentioned the finger test, we mentioned the biopsy, and we mentioned the scanning, the MRI scanning, which gives us a bit more accuracy. And the blood test as well. Right, let me do this. I will keep going over this throughout this month as well, to help raise awareness. Come on, I need a bit more flexibility in my wrists, I think. Feeling good at 90. Really good. I thought that 90 kilos would be really, really tough, but it's actually, that felt really good. We'll push it to 100. Feeling strong, man. It's good. So, on this. Whew. So the chances are you probably know somebody who's been affected by prostate cancer. It could be a brother or a dad or uncle. I certainly know people, and it's one of those where if it's detected early and treated, it is life-saving. So, right, Dylan. So essentially, a family friend of mine, you know, they were 63, still young man, and he got symptoms and signs quite late because they'd already invaded the bones. Now, the issue that you have with when it comes to the prostate is, if you have a prostate cancer that's growing quite central, then what it does is, when we're taking a wee, there's a tube that the wee travels along Now the prostate gland sits either side of that tube, and if it's growing close to that tube, what you're going to find is things like difficulty going for a wee, obstruction. You might have a bit of blood in the urine or blood in the semen as well. Feeling of incomplete emptying, or feeling that you're dribbling a little bit, dribbling urine, dribbling a bit of wee. That doesn't mean you've got cancer. It could mean that you've just got a growing prostate that is pressing on that tube. So that's a completely different condition. But the signs are very subtle, so it is advisable that you reach out to your healthcare provider or your GP to get checked if you do have some of those signs. The issue is, if the cancers are growing on the outside of that, so I mentioned I described it like a walnut. If it's growing central next to the tube, you could probably get some symptoms, but if it's growing on the outside, then it's going to be silent, so you don't have any symptoms. Now the issue is, if it's left long enough and not detected, as I mentioned through biopsy, you've got to know the right area to biopsy. It can spread, so it can spread down through the penis, through the urethra, into the waterworks, it could spread into the bladder, it can spread to the rectum, or it can spread fatally, unfortunately, into the bones. And because of the proximity of where it sits in the pelvis, it can get into the pelvic bones and hips and legs and spine very, very quickly. Travel along the veins, it can go up to the spine, and it can spread around the body. And I have seen that, and it can be quite aggressive. So early detection is key. You guys out there it's usually people aged 50, around 50, or if you are black or African American or African, then, or Afro-Caribbean, usually they recommend a screening around 40 years old. So, but it can affect anyone between 30 and 50. You're looking for strong family history, whether you had an uncle or a brother or a father with it, and even the research has now shown if you had a sister or a mother with a breast cancer or an ovarian cancer, go and get checked as well. So if you have a strong family history as well as age and ethnicity risk factors, do go and get checked. It is well worth it. Quick MOT on the prostate, you can visit your GP. So the growth and the positioning of them, as I mentioned, if it's central, if it's on the outside of the prostate, that's why we have difficulties in detecting the prostate cancer, because you don't know where to put the needle to biopsy. So it could be silent and you might not have any symptoms. You will need a specialist urologist or a GP to interpret the results, of course, because they can be quite tricky to interpret. I'm certainly not an expert at that, but I can do my bit to help raise awareness. Right, let's try 100. This is a new season's best. I haven't done this for a long time. Come on. Always clear the area. Safety, safety. So how can you do your bit? I mentioned earlier, you can donate to Prostate Cancer UK, Prostate Cancer Research, or you can buy the merch. Oh, no. You can buy the merch.
Oh, yeah. Do you have any idea how many I should do?
Sorry, mate?
How many of these should I do first time?
How many of what?
Pushing that thing.
The sled push?
Yeah.
How many? It's good, it's the best one.
Yeah, I know.
I do the sled pull quite a lot.
Oh, yeah?
How fit are you?
Out of shape. About
Do
2
you know
months
what?
in the gym.
2 months in the gym?
Yeah.
I would focus on not how much to do, focus on your technique.
Okay.
And don't worry about the weight.
Okay.
Focus on technique and focus on getting your energy, your fitness levels up then, getting your breathing going.
Gotcha.
And don't fall over like I do.
I'll try this.
I swear.
Is it just until you can't do any more, or is there like a...
I wouldn't go to failure.
Not failure?
No, not yet. No need, is there?
Yeah, wait till I'm skinny.
Because you want to keep the level of performance up rather than just going flat and failing. And then you've got nothing left.
Gotcha.
Keep the consistent level of performance going.
Pull or
I focus on technique, so I would get the rope and do some pulling.
Right, okay.
So pull it along with your legs, and if you want, you can get the rope around your waist and do some pulling in terms of like a sled drive, like a husky dog.
Okay.
Or you can push. But the main thing really is to keep a nice tight core.
Tight core? Okay.
Drive through the legs, full range of movement. But you don't want to be like that, because it's inefficient, isn't it? Think how the cyclists driving through nice and stiff. Yeah, straight. Your core will come into play, and your breathing technique will matter when it gets heavier. Core mainly, core, hips, coordination, and your breathing's key.
I'll be doing a lot of breathing by the end of this.
Yeah, but technical breathing though, to aim to help with the reps that you're doing.
Would you wrap around your legs?
Do what, sorry?
When you have the rope, is it around your core or around your legs? If you like
You want it around your waist.
want it around the waist?
If you're going to pull it along, it's going to be around your waist. Yeah, if you're going to pull it along, it's going to be around the waist. But
Around the waist.
I wouldn't do that at the moment. I would just focus on pushing and pulling it.
Pushing and pulling it.
Yeah.
Thank you, man. I
Yeah,
appreciate
it's all right.
it. See how far I can go.
Yeah. Step by step.
Thank you, man.
Step by step. That's good. It is easy. Let me help him. He's not quite got the techers. Sorry, let me just break off to help him 1 second. No. You're pushing it like a shopping trolley.
Like a shopping trolley?
Yeah, you're not around Tesco's.
I'm always a Tesco then.
Right, you're down here.
All the way down?
Yeah, look,
Like a
full,
lunge?
look at my stretch, look.
Got you.
And you're driving through like you mean business.
I see. Okay.
Get down, drive through. And that's why I'm saying focus on your core. Lower.
Even lower?
Yeah, that's why now you need to focus on your core.
Got you. Okay.
Head straight. You know where you're going because you can see.
Good point.
Drive. See, I can see you've not got the strength here in the middle of your back.
Oh, really?
I can see, it doesn't matter, but it'll come as soon as you just started. Yeah, that's why you need to do things properly. Awesome, yeah. Step by step. So I mean, it's easy to run before you can walk, isn't it? Focus on the technique, don't worry about how much. So, let me do another set. Took a lot. Right, clean and jerk. Damn, that was tough. clean and jerk. Yeah. Whew. Might need these 15s. Let's see. Believe. Yeah, you don't need much. To put 10 kilos on, you don't need to jump up by too much. 10 kilos. He's knackered. See, he's tired now. That's why you don't need much. All right, Darren. Whew. Right. Clean and jerk. Let's bring it all together. I need to get a couple of fives on. These fives are good for warming up. 10 kilos on top of the 25. Yeah. No slacking. No slacking. Brethren. Right, let's have a go. Head on. See what we got. Couple of fives. Right, let's get this up. We're well warmed up. Switch. Switch the angle because it's a bit easier to see with the clean and jerk from the angle, isn't it? Optimal. Got a bounce castle coming in 1 second. A few warm-up reps. Okay. Nice and warm. Do need these quads stretched, the explosive part. warm-up reps, get the system flowing.
On my social media over the last 2 weeks, and I want to give a bedroom, well, 2 bedroom DJs a chance to come onto the show, give them 30 minutes each, and let them show the world what they can do. So you've got me for the first hour, and then we've got 2 people for the second hour.
Feeling, do you know what? It really is so complimentary doing the front squat as well as the back squat, because you it's just a really nice progressive build-up into the clean and jerk, to be honest. Let's throw on a couple of pens. Are you blowing it up now or later?
It starts at 5, but obviously
What time is it now?
3:30,
Plenty of time.
but it's going to need to start going up 4-ish.
4-ish. Oh no, that's fine. Half an hour. Yeah, yeah. Sound. Yeah, mate. Oh, that's good. Beast. Let's get some reps out. That feels nice and good for the abs. Ah. Whew. Yeah, that's good. I think we're going a little bit heavier. Find that you can definitely go a bit heavier on the clean and jerk than you can with the snatch. Probably at all levels, depending on your ability. Need to get better at these lifts. so welcome. We're doing some clean and jerk. We go up to 50 kilos. This is the, of course, it's the prostate cancer awareness stream. So you may know somebody who's been affected by prostate cancer, and I've mentioned you can donate to them directly or buy their merch. They've got really, really good merch. So we'll be doing that throughout March. If you're at risk of having prostate cancer, if you have had a close family member, a brother or a father that's had it, if you're of black or Afro-Caribbean, African-American descent, a mother or sister with breast or ovarian cancer, go get tested. Silent killer. Look after your prostate, guys. Simple tests we've mentioned that can be done. Much simpler test than doing a clean and jerk. Please remember that just because you have an enlarged prostate, prostatic or prostate hyperplasia, meaning growth of the cells within the glands of the prostate, prostate hyperplasia, an enlarged prostate, you probably know it as, or prostatitis, an infection or inflammation of the prostate itself. They are not the same as the prostate cancer. They are individual conditions on their own. But some of the signs and symptoms of those three main conditions can be very, very similar. That's why it's very hard to detect. What I find really, really hard with this is to get my elbows right through. I don't know how to do it. It's like trying to get the elbow up like this. And I see people doing it and I'm like, how are they doing that? Maybe they got a wider grip, I don't know. But I need to get my elbows up a bit higher, I think. Whew. Let's have another go. These reps feel gorgeous. Right, let me grip it a little bit wider and see if I can get my elbows a bit higher. I think my biceps are blocking. No chance. Fall on your backside. NPC. That's the atmosphere, right. I'll go back to my original grip and see if I can get this. Feels good. It's just really hard to get that mobility through the thoracic spine and the shoulder. That's really, really hard. So yeah, buy the merch. Get your Prostate Cancer UK. Help raise awareness. There's lots of marches as well. March for Men. There's lots of meetups, groups of people, lovely people that get together, raise awareness. You can do your own charity runs and things like that as well. Well worth it. March for Men, love it. As you can see, 10 out of 10 merch, fits beautifully. Whew. Let's do another set. Another few reps, sorry. Yeah, I think we're ready. I think we're ready for a bit more. What do we put on? Let's put on 60. So if you do know anybody who's been affected by prostate cancer, there are specialist nurses and lots of helplines available. Their website's fantastic. It's probably one of the best research and cancer websites I've seen, actually. They've got their publications on there, they've got everything they've done. It's really, really informative, really explanatory, both for medical professionals like yourself and lay people, as they call them. Everything explained very well. So, anybody with a prostate can be affected, anybody born or assigned male gender at birth, essentially. So, whether you're male, identify as male, or intersex, or trans woman, and also anybody who's had genital altering surgery from male to female, they don't remove your prostate during that procedure, so you are still at risk of prostate cancer. So stay informed and get checked, because as I mentioned earlier, there's no national screening program, and I think until the tests become a bit more sensitive and a bit more specific, then there probably will be, because you're just going to end up with so many people with like flagged up as potentially having it but not having it, and so we need something a little bit more accurate. And I think we can screen it out. They're working on it. That's why you need to donate your money or buy the merch, and research will find a way. As you know, if you watch the channel for a while now, I love research, and research is the answer for everything that we have today, whether that is technology or science. So putting your money into research is a good cause. Evidence-based, what we need really. Evidence-based to help make better decisions. Right, we're going for the big 60. I think we could do more than 60, but I want to just increase a bit slowly, just nice and steady. Let's do a set. This feeling good, come on. I want to try and get mine on. I just don't know what it is. I think it's flexibility in like my shoulders, elbows and wrists, I don't know. Get that up. Anyway. First rep's always a bit rough. Try again. I had in my mind on that rep, I'm going to really get right underneath it. And I actually ended up on my backside. Will we try again? A lot of this is about balance. Come on then. Ah! Damn you. Try again. Got to get better at that. Oh. Just decompress. Wow. could probably go a bit heavier. Even if it's another. But I don't want my technique to falter. Because I need to be getting better at the underlift. Alright. Let's put on 2.5s. A modest amount. Sometimes it can make a bit of difference as well. Let's get this on. What a fantastic complimentary week. All sessions combined. Right, see how this feels. Maybe it's more shoulder flexibility that I need. Or smaller biceps. Triceps, I don't know. I'm only kidding. Right, it's another set. Do another rep. The weight gets heavier, you just need a little bit longer to recover. Not enough, not enough of everything. Come on, you gotta get right underneath it. Big drive up through the hips, come on, pull. A bit more activation through the shoulders as well, I think. Damn. See, that's only 5 kilos and that's made all the difference. We'll do it next time. Come on, no fail. Come on, no fail now, come on. Unorthodox. We've got to get it up there. Oh, I've just discovered something. When I reviewed the Lacoste base layer, do you remember that stream? They do have a pocket on them. I've just discovered, I just went to scratch my leg and I have discovered a secret pocket down here, which is actually quite big. I guess that's for bits and bobs. Okay, well it still scores a 10, and now it's even better because you actually have got a little pocket on the leggings. It's really discreet, and round the back, amazing. So there we go. Anyway, focus. Oh. Big drive, pull. Happy with that one. Two more reps. Come on. One more fact is the moment, at the current time of recording this, lung cancer is the #1 cancer in men. But I think now with occupational change, less exposure in the mines and to fumes, asbestos going, and less smokers now. I think this new generation of people obviously are doing more vapes and liquid nicotines. So prostate cancer is second to lung cancer, and prostate cancer with better techniques for detecting and research going forward, it probably is going to become the #1 most common cancer in men, but it doesn't necessarily have to be a killer. It's one of those cancers that when caught early, curable. He's okay. I've got 2 more reps. Come on. Just need a little bit of a boost. Come on, come on. Traveling. Travelled off the gym. That was unorthodox. Traveling. Go for a run. Running front squats. One more. I've got to, yeah. Just got to let the bar slide and sit a bit more and then get it up. Come on. Come on, finish on a positive. Oh, that was such a good session. That was so good. It all just felt so smooth, like complimentary. Beautiful. Right, let me tidy this up, more debrief. Let's debrief. 1st of March today. March for men who are promoting and raising awareness of prostate cancer. If you want to donate to their charity, fantastic research goes on there. Me, particularly as an academic doctor who loves research and loves treating patients. And actually, you know, come into contact, particularly when I was a younger doctor, as a first-year junior doctor, come into contact with prostate cancer patients. The first thing that strikes you is, you know, it's such a shame because it's so preventable, and obviously the patients that and the people that you see and the things that you hear, by the time it's spread to the bones, you know, they get hip pain, back pain, spine pain, you know, pelvic pain. It's too late. So get your prostate checked out, guys. Very simple, very easy, nothing to be ashamed of. There's a lot of stigma around men's health, I find, in general, whether that's physical or mental. It's kind of like, deal with it, you know, don't go till it's too late. Don't go till you're, you know, crawling at death's door. Like, yeah, dude, get your MOT done. Annual check. We spoke about the risk factors today, and we give a general introduction to what the prostate is. I will be recapping those things throughout this month because I think a reinforced, repetitive message will hit home. And I don't know when people are going to catch these streams. I know people watch them religiously, and I know others might just be flicking in, and then courtesy of the algorithm, it might just flash up in someone's feed one day. So I need them to also be aware if it's just a chance meeting that we have on YouTube and you are catching this. So if you can donate to them, do donate. If you can't, buy the merch. The merch is fantastic. I don't get any incentives to that at all. I'm just doing my bit as a doctor to promote healthy living. And one of those things is prostate cancer for this month because it's March. So raise awareness of it. What did we do today? We spoke about the basics of prostates, and we did lighter day squats with 145. We did 3 sets of 7 reps, and I felt the quads were like, that's because 2 days ago we did heavy squats. If you catch that stream, go catch it. And then we did front squats. We did a 100-kilo front squat, which I'm really happy with. That's a new season's best. I haven't done front squats for about 3 months, maybe a bit longer. So we've gone from 60 to 70 to 80 kilo to 100 today. That's testament to global strength increasing, better shoulder strength, better spinal strength, better core strength, better leg strength. So we did 3 sets of that. So bearing in mind, we did 3 sets of lighter squat, 145, 100 kilo front squat, 3 sets of 5. So there's a lot of volume there as well for the legs again. And then we went to do, we'd just done 70, was that 65 kilos? What was that? Yeah, 65, only 65 kilos on the clean and jerk. It's not my strongest exercise, I don't care. I'm gonna get better at it and I wanna improve. And I hope that shows you some contrast because if you're new, it can be quite scary, but you can also appreciate that perhaps some of the exercises that I do on this stream, I'm really strong at, I'm really good at, fine. But I have my weaknesses too, and if anything, that should be encouraging for you, that I fall over still, and I still fail, and I still have to work on technical difficulties, and I have to drop the weight, and I have to let my ego go and say, yeah, you're not very good at this, because it will humble you, and that's why I do this as well. It's just for a bit of fun, of course, keep healthy and strong. But it's quite humbling, really. It's a constant self-reflection when you're training. Even when I was doing that today, sometimes I'm actively running through the things I need to improve on, like it might be a grip technique or a breathing technique, or needing to get under the bar a bit more, or more power in the shoulders to pull through, foot position, all these things run through your mind. So it's quite humbling, really. It makes yourself aware of what you're good at. So I can't do very much on that weight lift, the Olympic lifting, so it's something I'd like to get better at. But I think I need to work on my flexibility, really, which we'll talk about in some upcoming streams. So thanks for joining. We are moving towards the end of strength season now. We've done 6 months, so it's amazing. We did the 6-month milestone in the previous stream. So we're probably going to do a few more weeks, and I'm going to try and max out and hit the bench press for as much as I can, and hit the squat for as much as I can, and hit the deadlift for as much as I can, and I might even do chin-ups. I don't know. I might even see how much I can chin up, because it's a really, really good indicator of upper body strength. So we'll see. And that's it, really. Prostate Cancer Awareness Month, March. Get your merch and spread the word. Raise the funds, get the sponsors if you can. It's really, what I liked about their research, when I was looking at their research website today, they've got very clear parameters and step-by-step about what they're going to do. So, and that's a good sign of research. They're not trying to find something weird and wonderful. They're just doing simple scans, contact with the radiologists, the urologists, the GPs, the specialists, and the lab technicians as well. And they're putting the money and the research into the right places to do the right kind of testing. So doing it tested, it's life-saving research, life-saving cancer prevention, ideally. And we also spoke about anybody born with a prostate, whether you're assigned male at birth, or if you're a trans woman, or if you've had genital changing surgery. We did touch on that. Genital changing surgery, at the time of recording this, they don't remove your prostate if you were assigned male at birth. So you are at risk of it too. Do go checked out if you are 40 or 50, between, let's say, 30 and 50, black or African descent, or anybody with family history. Risk factors. Good, right, see you again soon. Thanks for joining, amazing. I will let this guy blow up his bouncy castle. Right, nice one, see you again soon. I've got 2 days rest now, we'll be back again on probably Tuesday. We train again on Tuesday. Amazing session coming up. Right, see you soon, see you later.